Indications for the total shoulder replacement, that's the osteoarthritis, it's the most common indication. Other indication, rotator cuff damage, which is impossible to restore. Of course, total shoulder replacement sometimes is helpful to restore joint function after failed fracture treatment, or things like rheumatoid arthritis or oncology diseases. Total shoulder replacement is the last surgery which allows to restore normal joint function for the arthritic patient. Other indications for this type of surgery is massive rotator cuff tear, which is impossible to restore. Rheumatoid arthritis, sometimes we do this type of surgery when we're dealing with a fracture. So this surgery is usually we do during general anesthesia. Patients, they are completely sleeping. We're using anterior delta pectoral approach, and usually the surgery takes 2.5 hours, and after surgery we're using some kind of slim for mobilization of arm. Recovery after total shoulder replacement, typically we put arm in a sling, and rehabilitation starts after 2 or 3 weeks. But early passive motion is allowed. Exercises of the wrist and the elbow, it is necessary. Complications after this type of surgery is infection, joint dislocation, stress fractures, and of course late complications like polyethylene wear, prosthesis loosening. The time when you can drive, it's difficult to say. It depends on your physical condition. Returning to the normal work also depends on your condition, and my recommendation that when you can do at home after such physical activity what you do during your work, without any problems, you will be ready for the work.